So thank you, Jean.
Thank you very much, Simon, and welcome all colleagues. And I will also say croeso, which is welcome in Welsh to any colleagues who are with us from Wales. I've been introduced to you. My name is Jean Davies, and I am really fortunate to also, as well as a university lecturer, I'm in Bangor University in Wales, but I am most fortunate to be the deputy chair of the Association of British Paediatric Nurses, which is a new role for me. So it was really great to be a member. And now it's really great for me to be the deputy chair. So I really wanted to highlight a personal story, really, about working across the UK and across Europe and sometimes internationally, because we sometimes think we're confident about what we're doing and we've got the evidence for what we're doing in relation to children's nursing. And then we just hear something from someone within our networks and we think, what a great idea. Why are we not doing that? Or how could we do that? So what I'm going to go through now are just some ideas and maybe some suggestions. Sometimes when you see things on slides, you might be cast back in your mind to positive experiences, but also to negative experiences. If that's the case with anybody on the call, that anything we discuss is a little bit upsetting, or it takes you to somewhere that you didn't know you were going to go this afternoon, please chat with Bernie or Fiona or any of the other ABPN members who are on the chat, or please email me afterwards and we could have a talk about it. Because during our nursing lives, not everything goes to plan, and sometimes we have difficult conversations and difficult circumstances. So having said all that, I think I'll move the slides on now. Thank you. And please do contribute if you want to. So this is really just what I've said, but to also say why establishing strong relationships with partners is important. I would really like to raise awareness with you of the value of networking and sharing our successes and our challenges, and then how identifying things, sometimes known as wicked problems in health, helps us, once we've identified if we've got strong partnerships and networks, to be able to problem solve and come up with some great solutions that will produce improvements within children and young people's nursing. And then towards the end, I'll provide some examples and help us, if we can, to reflect on the benefits of partnership working. So, MAPS. We are obviously in the UK. I personally have worked within Scotland and also in Wales, where I'm working now. Colleagues will be from every region across the UK and maybe from the islands. So welcome, 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 a warm welcome wherever you're from. When I worked in Scotland and made lots of really strong partnerships, close friends, networks, this was a part of Scotland that I was working in. It was the NHS, Ayrshire and Arran Health Board. And the one interesting thing about Scotland is that the health boards are integrated with social services, social care boards. So they're integrated health and social care boards. And one of the advantages of that is that you don't really have two competing organisations with two separate funding streams. It's joint funding, you're working together, you know that the pot of money is there to help you to provide your services. And that has been the case in Scotland for several years, and it's working very well. I think in England and Wales, and obviously Northern Ireland, there has been a lot of talk about the value of integrated health and social care, but we're still not where we should be to make that a reality. This is a map of Wales, and I'm in Bangor, so this is this little leg that's sticking out here. Bangor is there. This is Ynys Môn, the Isle of Anglesey is its other name. This is a Llŷn Peninsula, and then this is North Wales, and then we get to Mid Wales and South Wales. A lot of rural areas in Wales, if you're in where the majority of the population is, so anywhere from Chester in England through the North Wales coast, down to Wrexham in the north, and then you start getting the mountains and the rural areas, and that presents its own challenges for working and providing equitable services. It was the same in Scotland. The Health Board has responsibility for two islands, this island and another island here. So the Isle of Arran and the Isle of Cumbrae. So when any health services are trying to provide services that are not a postcode lottery, that are equitable with adult services and certainly equitable between children's services, it is quite a challenge. So if you think about the UK and you come down to the southwest of England, Devon, Cornwall, you possibly will have some of the same issues about postcode lotteries. In Yorkshire and the North East, again, there can be some isolated boards who may feel they also have some challenges with rurality. And then when we go across to Europe, it's the same sort of thing. There are areas where services are very accessible and areas where services are less accessible. And the way that services are run within Europe, there are different funding models. So we have to bear all this in mind. And you may know of the group of Paediatric Nurses Associations of Europe, and we'll say a little bit more about those later. But the paediatric nurses, children and young people's nurses across the UK and across Europe are trying to standardise services so it's not quite the postcode lottery that we've been talking about and thinking about. Now, this is a very busy slide, and it's trying to highlight just how many people are involved with a child and a family. And this isn't an exhaustive list by any means. I'm sure many of you would be able to add to this list. But if we think about a child and family, whether a child is reasonably healthy all their lives and access universal services, immunisation teams, school health services, or if a child has complex health needs, a disability, or a long-term diagnosis, that child and family, through to being a young person and transitioning through to adult services, are going to need lots of people around them to begin to have some sort of coordination for their care, the right funding that they need for a decent quality of life, and to get access to all the equipment and services that they need. So I'll just move on to the next slide, but the message I want to take from this one, it's many, many others, and it's that expression, it takes a village, takes many, many people to input into the care that's required. So these are some of the links I have to some of the networks, associations, organisations and charities that I have worked with. And in this presentation, there are interactive links for you to go straight to some of these organisations. So one of the organisations that have been very influential in improving services for children, young people and their families are Action for Children. And there are thousands and thousands of charities, and we cannot thank them enough for what they have done. The key for all of us is to know who they are, what they do, how we can access them, and how children, young people and families can access the charities. So Action for Children is accessible. They've got a website. Some of these others you probably will not know. I just want to tell you about the 22nd Ayrshire Crosshouse Hospital Scout and Guide group. When children are in hospital, it's a very alien environment. Even children who are in and out and quite familiar to us, there isn't much of a semblance of normality for them when they're in hospital. And Crosshouse Hospital, where I worked in Ayrshire, had a hospital school, which was great. And we used to invite people in, like, people who were known to school, reading clubs and things like that. And the children really enjoyed it. And then one day I was approached as the manager of children's services to say, what about Scouts and Guides coming, maybe for 1 hour every week in the evenings, for the children to do something that they might do normally outside of the hospital. So after a lot of conversations and risk assessments and so on, all the paperwork and all the disclosures that needed to be done to ensure, safety, the Scouts and Guides were set up, and they came in every week. And when the children were discharged from hospital, they could link in with the groups out in their communities. So it was very successful. Then the Ayrshire Quilters, Project Linus organisation, are people who sew quilts, and they're well known. They started in America, and some of the beautiful quilts that you might see in neonatal units or on the beds in children's wards will have been put together by Project Linus Group and the Quilters. So I did want to mention those groups because they make a local and significant difference. And unless you know about them, the children are not going to get the benefit of those things that matter to them. I don't know whether you've looked on Care Opinion at all. And Care Opinion is a platform where the general public will send a post to say, I had great care, or my care was abysmal, or my care could be better. And the providers of care can respond on the platform and say, we're sorry to hear that your care wasn't up to the usual standard. And they may invite the people then to come in and discuss their health journey, and improvements can be made. So it's really important to look at what is being posted and for care providers to respond, and then not to just leave it there, but to work together to make some improvements. So I'll just go down the list again to the Children's Hospices Across Scotland Association, which is abbreviated CHAS. And CHAS have done so much to improve the care of children with life-shortening, life-limiting and life-threatening conditions in Scotland. And I don't know what experiences you have of hospices, but it might be, quite beneficial for everybody on the call and the wider membership if you maybe could put some of your experiences of working with hospices and other charities in the chat, so that it really extends our knowledge of what is available. Children's Health Scotland were formerly known as the National Association for the Welfare of Children in Hospital. That was called NORCH. Some people might remember it, but in 1991, NORCH changed their name to Action for Sick Children. And there is an organisation across England and Wales, and also one in Scotland. But Scotland changed their name in 2017 to Children's Health Scotland. Again, a very influential charity who will sit round the tables of the Royal College of Paediatrics and Child Health. They will have the ear of government, and they can make a difference. But they can't make a difference unless we actually let them know what's not going right. They can't spread and roll out excellent models of care if we don't say what those are. So our place and our role in improvement is a significant one, and we should all try to remember it's hard enough doing the day job, but we also need to spread the word about things. So if you remember, I was talking about Scouts and Guides coming into the hospital and the ladies bringing quilts in. But you may have heard of this charity, Hearts and Minds and Clown Doctors. So they used to come into the hospital too. But they are a charity who will match you're paying for several sessions. So if you pay for 6 sessions for Clown Doctors to come in, they will give you 6 sessions free. If you pay for 1, they will give you 1 free. So again, there was a little bit of curiosity about what Clown Doctors might do and whether children might be frightened of clowns. I remember a paediatrician saying to me, "Oh, I'm not too sure about this." But when they came in with their full of fun, with their banjos and their singing, everybody absolutely loved them. And the mood and the joy of their session, and when they went, it certainly contributed to recovery. You could see it before your eyes. It was an amazing thing. So those are some of the lists, and the list goes on. So Kidney Kids in Scotland, they have provided machinery, home. I've just forgotten everything they provided, but lots and lots and lots of care and attention for families. They have also provided staff and training, posts, charity-funded posts, and I'll be saying a little bit more about them later. Magical Smiles, Magical Smiles is a charity run from, it was run from a local mosque in Ayrshire, and they used to ensure that at Eid, which is the festival for the Muslim faith, that every child would have a present, regardless of culture or religion. They would come in June before they went on their pilgrimage and Hajj to bring things for the children. It's part of the experience of that festival that they would be giving as well as receiving. NHS Education Scotland were absolutely formative in ensuring that they knew what training was needed, not just general training, but specific training, maybe on palliative care, maybe on health visiting, on parenting. We could ask them at any time if they could provide general training, bespoke training, and they certainly would help us. Paediatric Nurses Associations of Europe, I've spoken about, and our Royal College of Nursing, really important for us for standards, along with the Nursing and Midwifery Council. The Association of British Paediatric Nurses, ABPN, we're all about ensuring that best and highest quality evidence-based standards for everything that we do. And working together with these networks, we can have a degree of confidence that we are providing the best quality of care that we can. And where we are not, we would seek to get advice from these organisations here to help us. So each government department has got a Children and Families Directorate. So this was the one that I was working with in Scotland. And I would also like to mention Talking Maths. Now, I don't know if you're aware that this is a form of communication that young children and young people learn when their verbal abilities are not enough for them to be able to tell their stories or get their messages across. So I can tell you a bit more about that soon. And then the Well Child, National Children's Charity. They have been, for me as a clinician, fundamental in providing nursing posts, step down facilities, as in a mock-up of a person's home with, so we could teach parents and carers how to maybe perform procedures. We would video those procedures and get feedback from the parents or the carers what they thought were doing right. Just going to stop a moment and go to Bernie, because I think you have the same type of facility in Edge Hill University too, don't you, Bernie?
Yeah, we have a really great room that is set up as if it's somebody's house.
Yes.
And yeah, we've got videos there and parents can come in and learn. It's really fabulous.
Yes, so we emulated yours. We came to see your facility and then begged for the same one in Scotland, and Wellchild supported us with that. So I think that's two of us now who are saying, you know, really using the expression, reach out to these charities. They are so helpful, and they want to make a difference to children, young people's and families' lives. So just a little bit more now before I show you some pictures of different organisations. So I was privileged to receive invitations to participate following recommendations from Fiona Smith, who's on the call, Katrina McNamara, who you will know is not on the call this evening, and from colleagues within NH Education Scotland. So they're the people who helped me to get a seat at the table and to make me aware of what is available apart from NHS and social services. I've worked jointly to identify the wicked problems, solve problems, and co-produce improvements working together. I've been fortunate with the organisations to proactively contribute to work plans and develop best practice standards, to raise awareness of evidence-informed improvements within children and young people's care, and then to disseminate the information and the resources through meetings, teaching, publications, and conferences. We have to get the word out. So you will have seen this this slide, certainly when you go on the website for ABPN, the oldest children's nursing association in the world. What an accolade. So we are fortunate to have the president on the call today, Professor Bernie Carter. The chair is Karen Eyre. I'm the deputy chair. Fiona Smith is on the call. Simon was on the call. I'm not sure who else from ABPN is on the call too, who are post holders or belong to working groups, but please put in the chat if you are, and maybe what your aims and aspirations are for future working groups or for making improvements. So Royal College of Nursing, you will have seen their website too. For me, I've been a proactive member for as long as I can remember, it's decades, and I do always contribute to anything they circulate to say, please give us your opinion. It's really important that we get our voices heard. Royal College of Paediatrics and Child Health are key partners. They're making the case for children within the 10-year plan for England, but we must make the voices heard for the 4 devolved nations. You know, we really need to make our views known about what we expect for children. 10 years is an awfully long time, and who knows what we're going to be like in 5 years, never mind 10 years. Bernie and Fiona, have you anything to add about your visions for a 10-year plan? Can I go to Bernie first, please?
Okay. I would just like in 10 years' time for things to be unrecognisably better, because it feels like at the moment they're unrecognisably bad and getting worse.
Yes.
So it's hard. I'm never not optimistic.
Mm.
I do think there has to be some radical changes in both thinking and both implementation of changes for children, young people and families.
Yes.
And babies. So yeah, I think this is this and some of the other moves that are happening are a start, but it needs to be more than words. It needs to be actions, and it needs to be felt on the ground, and we need to be able to support the people that are actually delivering the services.
Yes, thank you, Bernie. If we go to Fiona now, and then we can just ask the rest of the people on the call if they have something they would like to say. So, Fiona, please, would you come in?
Yeah, I have to say, I agree with everything that Bernie has just said. I have seen similar things repeated throughout my career. And I think if we go back to the children's NSFs, for example, we will find a lot of what needs to happen this time round. Again, as Jean says, some of what's in Scotland and indeed some of the other countries, we need to learn from and build on.
Thank you. Would anyone else like to say what their vision would be and what they would like to contribute to the consultation?
Carol Williams has just put something in the chat box. Carol, I don't know if you want to say anything.
Please.
I'm now working in primary care, courtesy of COVID. So I no longer work for myself, and I'm working for a GP federation, and we cover all of the practices in West Kent. We work with them and support them, but we also provide another range of services. But one of the things that really surprises me is there's almost no mention of children in primary care, apart from children's and young people's mental health. And what we're seeing is a few mental health practitioners, but largely social prescribers or young people's care navigators dealing with mental health issues in primary care. And I do think, you know, we're perhaps not looking at this with the right glasses on. We're putting little sticking plasters on and they're rapidly falling off. And certainly I'm dealing internally with some social prescriber concerns raised where they do not have the knowledge and skills to deal with the sort of cases they're being referred from within GP practices. It's a real concern.
Oh, thank you for highlighting that, Carol. So is there some way we can mobilize and make a difference here?
It was one of the things I'd hope to catch up with Fiona about and have a conversation with Fiona about how we can move it on, because I, you know, try and raise children in discussions, but the focus is very much on frail elderly adults, and there's a lot around adult mental health actually as well. So but children just don't appear to get a look in. I know very few practice nurses who've got a children's nursing background. Most of them come from the adult sector, and a lot of them are seeing children in the practices. It's quite a serious problem.
Thank you, Carol.
We'll catch up afterwards, Carol, because I think there is something that needs to be sorted. But there we go.
Fiona, I will probably have to send you some possible dates if that's okay, because I do have to leave about 10 to.
That's fine, no worries. Jean, we've got about 20-25 minutes left. Okay, I just thought I'd flag.
Thank you. Is there anything in the chat in relation just to this 10-year plan, or does anyone else want to contribute anything there?
Bernie's highlighted that we need to address some of the root causes of child ill health, which is key.
Yeah.
Thank you so much. I'll just move to the next slide then. So I did speak about these in the earlier slides, the Paediatric Nurses Associations of Europe, and very influential. We have the actual creator, the developer of this association on the call, who is Fiona, and I would be very remiss if I didn't invite Fiona just to say something here.
I think the whole linking with other paediatric nursing associations of Europe was born out of the need to learn from each other and to take things forward, to raise the profile of the need to have nurses that have the right knowledge, skills and competencies to care for children and young people wherever they receive care, whether that was within hospital or other facilities, or indeed in the community.
Mm-hmm. Thank you, Fiona. And it's been a very successful organisation. So please do visit the websites of these organisations, because we don't really have enough time to go into the depth of all the work that the organisations have done. So I'll just move to the next slide. Bernie, a collaboration. Do you want to say something about eye support? Every children's nurse needs to know about this, and others who are not children's nurses.
Yeah, this is work that Lucy Bray's led on. I was involved with putting the bid in, but she's been the kind of the dynamism and the energy and the leader with this. And it started from an absolutely tiny amount of money, a kind of the notion that we could put in a bid for something really small, and it turned into something really big because we didn't quite know how to sort of stop engaging with people. So over the period of time that the project's been going, and it's still ongoing, Lucy has led on engaging with nurses, advocates, psychologists, youth workers, anybody that is actually involved in working with children, to try and improve children and parents and those stakeholders' understandings of children's rights, particularly in relation to, very specifically in relation to sort of the children coming and having tests or interventions. Whereas the evidence that we've got shows that typically what happens is a child will come for a test or an intervention, and the Nike approach happens, like we just get on with doing the blood test or giving the eye drops or taking them for x-ray, because the systems that work around us encourage that sort of processing through a system. That's not to say that there's not really brilliant practice in some places, but typically it's not easy to deliver that sort of care. So the whole of the eye support programme has been working out how to create a set of standards that could be used and could be, people can say, this is what we should be doing, with an evidence base to go with it, and then creating a range of different media and leaflets to actually provide people with that information. So we're just finishing, or Lucy's just finishing working on a very, very, very slimmed down version of this leaflet that you can see here for children who have got very little in the way of speech and use symbols rather than actual words. And we've got audits that that nurses or professionals can use to audit their own area, to see right from the moment a child comes, first point of contact with whatever setting it is, all the way through to the end of that contact, to try and ensure that their experience is the best it possibly can be. And a lot of it is informed by the fact that these interventions, as routine as they seem, can be traumatic for children, and trauma in the proper sense of trauma.
Yes.
A genuine sense of these things create problems that can be lifelong for a child.
Yes. And I suppose, you know, we learn a lot about ACEs, adverse childhood experiences. We do not want to be causing these adverse childhood experiences for children. So it's really important. And it's international research, isn't it, Bernie?
Yeah, lots of different countries from South America, North America, across the whole of whole of the world, pretty much. I think it's 72 countries and counting.
It's enormous now, isn't it? So please do have a look at this. Please do. Thank you, Bernie.
All the materials are free as well.
Yes, and you can print out the posters. I've asked all the students to put them wherever they go on placement, print a poster out and put it on the wall. So another influential group of people for improving standards for children's palliative care. So we've got Pelican, which is the Scottish network. We have a charter for dying children that Fondazione Marusa, who are an Italian charity, and they have a congress every second year in Rome. And, you know, you can learn so much. If you can get funding, if you can apply for funding to go to some of these congresses and conferences, you usually will be able to access master classes too, which when you come back, you will really have heightened and enhanced your knowledge and skills. And on the slide, you will see what I've been able to do by having links with these networks. My experience of working with charities has been a bit like Bernie says, preparing bids, submitting the bids, really making a difference. So I'm just going to move to the next slide now. How many charities are there in the UK? So there are thousands of charities, 412,282, and they're not, many of them are not for profit organizations. So if we can do half marathons, if we can do a bake sale, whatever we can do to support the funding of charities would be a great thing to do. Get the school children involved. We know that there is a lot in the news at the moment about hospices not being fully statutorily funded and the reliance on charity funding, people being laid off in hospices, and beds not being fully utilised. So it's really important that we know about charities and what they're there for. So this is just something about the acts for the charities, and you can look at that and you know when we finish the call. So these are charities I've already spoken about, CHAS and WellChild, and a bit more information about them. I've been very, very fortunate to receive real funding that has made a positive difference to the services that I was able to provide as a children's services manager. So again, Kidney Kids, significant charity. Sheena Dunsmore founded this charity. Sheena was awarded an MBE for the work that she has done. So again, people have put their heart, soul and lifetime into helping people. Children now have home hemodialysis as a result of the work and the funding that Kidney Kids have provided. So what a difference. Action for Sick Children Scotland, as they used to be, they had noticed that young people were going into adult settings and the services weren't the optimal that they could be. So we worked together, we published in the newsletter, we worked with an organisation providing epilepsy services for young people and made improvements. So please, if you can, access this work and have a look. These are some of the quilts that the ladies made that I was talking about earlier on. They also knit bonnets, booties and maternity coats for the neonatal unit. And I love the phrases they use. A quilt is a hug you can keep, and every quilt is stitched with love. And they are so passionate about providing children with these. And if we were to let the group know a particular character that the children love, they will make a bespoke quilt of that character, and the child can take the quilt home once they've been in hospital, and they will make us more quilts. If the child is being nursed at home, they would send the quilt to the child's home as well. I talked about magical smiles earlier on. So these are the gifts that they brought in at Eid. Really important for equity, equality, diversity, inclusivity. You know, we should be very mindful of people coming from all cultures and backgrounds, and the way that we include everyone is really important. Hearts and minds, I talked about the clown doctors before, and this is what I did. I got 6 sessions paid for out of our endowment fund at the hospital, and the charity matched it with another 6. So we had them coming in every month. Scouts and Guides, I told you about them. Children and families said that for a little while they'd forgotten that they were in hospital, which you can't really ask for anything better than that. So again, this is just something that was in the local paper. When we got money to refurbish the garden, we had a garden party, and this was my thank you to everyone. Without all our children, family and friends, we couldn't have had such a lovely day, and we're looking forward to the next year's garden party. So just these things where you can make a difference. So again, some more narrative about what we're trying to do. Identify inequalities and gaps in service, maybe undertake research and establish our current situation, and then get the findings out so that other people can maybe benefit. So I did some my research with children and families to ask them what their views and experiences were with the provision of healthcare that we had. So I was so struck by their responses. This young lady, she was 15. I can remember having pneumonia very vividly, my lips as blue as seawater, struggling to breathe. I must apologise to the doctor who got a mouthful of abuse from a 5-year-old me. Then this young lady talked about doctors who were more abrupt. There were 2 consultants. One was really had a great manner, but the other one wasn't. This really struck me. Saying this condition is draining is an understatement. Another chest infection, doped up on medication and feeling like the walking dead. That's the experience of children in hospital. You know, so we do need to bring something of normality and some joy into a hospital day, into a community stay. If they're going to short break centres, we need to be very, very mindful. And talking about mental health, Carol was talking about mental health. This was a mother of a child who's aged 8, and she said we actually paid someone privately because it was getting to the point of her daughter, being physically sick going to school. So again, CAMS, how important is that? So I'll just move quickly to talking maths. So 2 of the young people, well, it was a boy of 8 and a boy of 9 who I was interviewing for my research. This is the resource that they used to tell me their story about what was happening with them. And so you can look up this, but this is my resource. I'm trained in this technique, and I find it extremely useful. So these are the talking maps that the boys did. And you will see that they've got the icons up here, and they're able to, from this set of pictures, say what is good and what is not so good for them. So in the original resource, there's a maybe, but I was very mindful that the 2 boys may have had like a cognitive overload. So I decided, and my research supervisor agreed, to take the maybe out and just ask them, is this right for you? Is this not right for you? And these are the maths they produced. This boy was very overwhelmed with all the procedures. The medication is constantly needing to be weighed. He couldn't take anything by mouth. He had a gastrostomy tube. He was very sensitive around his mouth. This other boy, he liked his wheelchair. He liked going to school, but he didn't like writing. He didn't like people holding his pen steady. He just didn't like it. His mum didn't even know that. So how important is it to get children's views? Very important. So the lived experience, really important. And as we were saying before, trying to prevent some of these other adverse childhood experience or ACEs that do shorten people's lives. I talked about care opinion. This is one of the stories. You can have a look at that one. It's still there. So my question to you now, before we finish, as nurse leaders of the future, what will you do and who will support you to improve services for children, young people and their families? Work in partnership with all nursing, medical, allied health professionals, the whole list that I showed you before, so that we don't miss the boat in relation to this very valuable, fully integrated partnership working. And just my personal story is coming in a moment, because it is a climate of social difficulty. Bernie highlighted that very eloquently earlier on. It takes a village. Please be the best you can be, physically and emotionally, to help you to care for others. Work with the community. I put this up because self-awareness, taking care, recognizing your emotions, there's tons of YouTube videos to help you to relax. Really important that you do. This is me over the years. I want to just say to you, believe in yourself, hear and act on the voices of the child, family and their advocates. Understand and promote the value and power of partnership working. Be courageous. Be proud of your nursing profession. Always act with compassion, kindness, certainty, humanity and humility. My emotionally rewarding and enlightening journey may inform and guide a pathway to yours. And finally, credit for service improvement does not belong to me. Whatever I've done does not belong to me. It belongs to the courageous children, young people, their families, and the wonderful teams and volunteers who support them. Thank you so much for listening. Thank you. If you have any questions or reflections, please put them in the chat. I'll just stop sharing now. There's references on these slides, but diolch yn fawr. Thank you very much indeed for listening.
Thanks, Jean. A lot of people in the chat have thanked you also for an inspiring session, which has been really helpful, I think, to everybody. And indeed, Elizabeth's clapping her hands.
Oh, thank you. Thank you so much.
Okay, thank you, everybody. And thank you, Jean. Yeah, just echo Fiona's thanks. I think what a real inspirational story that you've been able to share, and with your experiences of working across families, children, young people throughout across all nations as well. So it's been amazing and really inspiring as well. So I think for me, myself, who's kind of still in the thick of it in terms of working within the integrated care boards and have children and people as one of my portfolios and priorities, I think we sometimes can lose the sense of who we are as children's nurses within that. And actually, like you, my champion every possibility, the voice of and experience for children and people. And that's where I think, like now in similar positions that I have now, are able to continue to influence and make those and hopefully make those changes for the best of children and people and families. So yeah, it's great to to have been able to hear your your journey as well today. So thank you. So I'll stop recording, and then we will end the session. Again, if there's any comments, please try and pop them in the chat, or like Jean said, if there's any anything that's caused any kind of triggers or kind of any thoughts about kind of how we've worked together. Again, obviously the offer's been there from Jean and other members of the ABPN to reach out and support where, if and when needed. So I'll leave today to say thank you again, Jean, and thank you on behalf of the ABPN. I'm really looking forward to finally getting to work with you. I've not formally met you yet, so thank you. And we'll see you all at the next webinar, which is on the website, and I can't remember the date, but it will be in January.
I think it's the 16th of January, and it's Dr. Stephen McKeever talking about writing for publication. But I've just agreed another webinar today for May. So they keep getting updated. So the important thing is to check the website.
Yeah,
perfect.
It is the 16th of January at 9 till 10 with Stephen in January.
Because he's doing it from Australia.
You probably have better weather than we will have, I'm sure.
I'm sure, yeah.
Yeah.
Oh, thank you. It's been a privilege, everyone. Thank you so much.
Thank you.
Take care.
Bye.